If we're talking about an acute injury to the knee, let's say a knock from the side, for example, this is actually a right knee. Now, if it was, there's a blow to the side, you're playing football, we get tackled and your knee goes bang like that, that's quite likely to damage this ligament at the side here called the collateral ligament. From the other side, it could damage this other ligament on the other side. If, on the other hand, it's more of a twist, and twisting injuries such as skiing injuries or twisting during football will tend to damage the meniscal cartilage inside the knee, and it's not uncommon to get a tear within that meniscus. If, on the other hand, we're talking about a more gradual onset to the pain, then you're more going down the route of wear and tear problems such as damage to the articular cartilage overlying the bone, problems with things like the beginnings of osteoarthritis, or it could even be a disease process or autoimmune conditions such as rheumatoid arthritis. Problems with the kneecap as well can often cause problems. So the kneecap at the front here, or the patella bone as we call it, that can undergo certain problems. You can get wear and tear on the undersurface of the kneecap. It can also lie slightly out of position, not in the middle of this little groove here called the trochlea. That's quite a common cause of anterior pain at the front of the knee. We'll obviously want to examine the knee itself and actually feel the knee itself, but you get a lot of clues, or I would get a lot of clues from listening to the patient's story. So, for example, if there was some swelling and that swelling came on very suddenly within a couple of hours, we'd normally be certain that that swelling was due to blood. So that would imply something like an anterior cruciate ligament tear, or some other sort of tearing to the vascular structures within the knee, such as the edge of the meniscal cartilage. On the other hand, if that swelling came on gradually, let's say over 24 hours, then that would indicate more a case of effusion, which basically means the knee, that the natural fluid which is inside the knee is increasing. And that's more indicative of things like damage to the articular surface of the cartilage, articular surface cartilage in the knee, or it could even be inflammatory conditions such as rheumatoid arthritis or osteoarthritis, for example. If, on the other hand, you experience locking, meaning that you're trying to bend your knee and you can't straighten it to a degree, and you have to kind of really do a funny wiggle and then you can get around it, that is often quite an indication that you've torn a meniscus, or one of those meniscal cartilages is torn. So as I say, you get lots of clues from questions and actually asking these questions in clinic. The ultimate test, however, to confirm the diagnosis, I would say, is with an MRI scan. The MRI scan will be able to see right inside the knee, and you'll be able to see exactly what structures have been damaged. If the pain and injury is involving the ligaments either at the sides of the knee or the tendon at the front of the knee here, then we'll most likely want to do some local treatment to those structures, which will probably involve ultrasound therapy, shockwave therapy, and some other manual hands-on treatment. However, it is important to remember that the knee is essentially a hinge between the hip and the foot at the bottom. So very commonly, in people who have long-term knee problems which aren't a result of a twist or an acute injury, let's say, we'll often find there's biomechanical problems going on at the hip and the foot. And what happens is, most commonly, is that the leg itself is rolling inwards. So for example, if you've got weak glute muscles in the hip, that will, when you're walking, mean that your knee rather, is most likely rolling in too much, and that will twist and put strain through the knee. Similarly, in the foot, if the arches aren't correct in the foot, then when you walk, the arch can drop in too much and you get this twist and torsion happening through the whole of the leg, and the knee, which is the hinge in the middle, gets this strain. So they're the patterns we need to look for and trying to address as well for a long-term result. If it's a case of sudden pain and there's perhaps some swelling, then ice is the thing to use, especially for the first few days. Get an ice pack, put it on the knee, keep it there for about 15-20 minutes. Try and have your leg elevated as well, so you're lying down and your leg is higher than your body, or actually higher than the heart. That will help to encourage the swelling to go down. If we're talking kind of longer term than that and it's generalised knee pain that you've had for a long time, I would say try and lose weight, because there's lots of evidence now to show that even if you can just lose a little bit of weight, that will mean there's a lot of less strain coming through the knees. Try and stay as active as you can within the limits of your pain, but try to opt for things that are less weight bearing. So running is not a good idea for knee pain, but go for things like swimming, even cycling, provided the saddle height is correct. Often that is something you'll be able to do, and it's quite nice for the knee. It can keep that motion into the knee, keep the circulation, the fluid circulating around the knee without overstraining it.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.